taking the approach of a neurologist and how we treat pain syndromes and other neurological conditions, it's all kind of in a milieu now. It's really exciting for me to not only pioneer that approach to patient care, but also to stay abreast on what's out there that is cutting edge, what is new, and what can be brought into Mcgreevy Neurohealth in order to provide patients with that much more. And that's really what excites me. You know, when I was going through neurology residency, I was heavy into research, and in particular clinical research, where I would take part. I'd actually created my own clinical trial, and that inquisitive mind is, I think, really important for physicians, whether they do research or not. And I've always sort of had that, and so that translates really into how I approach things here. What's on the forefront? I want to be on that edge there, because ultimately the patients need it. They need something, you know, and a lot of neurology practices may do a great job and a standard set of procedures and items, and pain management in the area may also do a great job and do a certain standard of care. I like to take it a step further and really see, well, what else, you know, what's coming down the pike, because ultimately if we can stay on the forefront and we start instituting these things, then we already have a step up, so to speak. You know, we already have the ball rolling, and when it becomes a standard of care, we already had been doing it, you know, and at that point then it's just fine-tuning it. So in pain management in particular, spinal cord stimulation comes to mind as a cutting-edge technology. It's been around for a little while now, but within spinal cord stimulation, there are ways to make the treatment feel better for patients who experience pain, and to reduce any side effects that the stimulator may produce in a subset of patients. So the technologies of playing a little bit with the frequency of how fast the stimulation's occurring has really become a technology that I like, you know, and I think it's really shown to be an improvement in patient care. So some patients with a spinal cord stimulator in the past had received relief, but they also have this kind of a buzzing sensation that they experience in the areas where they have the pain. And in a subset of those patients, they may feel that it's a little aggravating. And now we've been able to eliminate that. So that little buzzing sensation gone, now we just have the pain relief, which is really what the patient's looking for. And so those little nuances, the high tech has really come into play with stimulation, and has really translated into improved patient care and comfort.